Dr. Aruj Mian, and I'm a PGY3 internal medicine resident at Advent Health Orlando. And today I will be presenting a very interesting and rare case of Vibrio vulnificus bacteremia. Our poster is titled "A Raw Deal, a Dangerous Dietary Indiscretion." Introduction. Vibrio vulnificus is an aquatic gram-negative bacillus that can cause diarrhea, soft tissue infections, and septicemia. Vibrio vulnificus's most prominent impact is seen in patients with chronic underlying illnesses such as cirrhosis or hemochromatosis. Predominantly seen in summer and early fall, this aerobic bacteria is abundant in recessed coastal bodies of water. Foodborne illness is transmitted via filter-feeding organisms such as shellfish, which concentrate Vibrio vulnificus to levels higher than the surrounding water. Case presentation. We present a case of a 56-year-old male with metastatic stage 4 gastroesophageal adenocarcinoma actively receiving chemotherapy. The patient presented with severe weakness and urticaria on the lower abdomen and thigh, as seen in figures 1 through 3. He was febrile with clinical indicators of septic shock. Following ICU admission, blood cultures were drawn, 30 ml per kilogram fluid bolus was given, empiric antibiotics with vancomycin, cefepime, micafungin, and subsequent vasopressor therapy for septic shock was provided. Blood cultures initially showed gram-negative rods, suspected to be line-related. It soon speciated out to be Vibrio vulnificus, and at that point, patient was further asked about travel and recent food ingestion. He admitted to having just one raw oyster a few days prior when out with family. The sensitivities showed good coverage with cefepime, and other antibiotics were stopped. Following several days of treatment, he was downgraded safely from the ICU. Below, figures 1, 2, and 3 demonstrate a blantering erythematous rash involving the bilateral inner thighs on the left, and a rash involving the left thigh in the middle, as well as a rash involving the left lower quadrant of the abdomen on the right. Discussion. Vibrio vulnificus is a pathogen which exerts its greatest effect on immunocompromised hosts. Found in marine environments, this organism can have lethal consequences if not suspected and treated swiftly. Mortality approaches 35% in immunocompetent hosts and nearly twice that in immunocompromised individuals. Broad-spectrum gram-negative coverage with cefepime, often the empiric choice in the ICU, has good effect against this agent. Our case urges the importance of thorough history, including recent diet. Vibrio vulnificus is the leading cause of all seafood-related deaths in the United States. A large portion of patients with Vibrio vulnificus septicemia report having consumed raw oysters. Oyster bars have warnings against ingestion by immunocompromised people for this very reason. Thank you for your attention.